This conference will now be recorded.
All right. Good evening, everyone. Welcome to the RMC support group for June 2021. It's good to see everybody. Hope everybody is doing well. I see we have a new face in the group. Anna, nice to meet you. So I think we should start with the introduction. Let's introduce ourselves to Anna so she can kind of see how everyone is related to RMC. Um, Carissa, do you want to give your introduction first?
And my husband had renal medullary carcinoma. He was diagnosed in 2016. He battled it for like over 3 years and passed away last year.
And what's happening this month, Clarissa?
This month is going to be his birthday. Would have been his 32nd birthday, and a couple of days ago was our it would have been our it was like our 5-year anniversary.
Okay. Lori.
Hi, I'm a godmother for Kwanzaa Daniel, who isn't on the call yet, but might be later. Kwanzaa was diagnosed. Kwanzaa lives in Anaheim. Yeah, Anaheim, and that's why I asked Anna about you. And Kwanzaa was first diagnosed with extreme pain and a tumor found, a 5-centimeter tumor found in early October. She wasn't biopsied till the second week of November. And so November 17th, they diagnosed her with RMC. The surgeons at City of Hope in Duarte, California, felt that she had a narrow window of opportunity to remove the kidney and all the cancer at the same time, or most of the cancer at the same time. So she had lymph nodes and the tumor and her kidney removed. And then she did 4 rounds of combination of either cisplatin or carboplatin. In April, she was told, and the last time I think you guys saw us, we had been told that her scans were clear. But in reality, they went back and looked at them again and found that she had a 2-centimeter tumor in sort of the excision area, or the area of the abdomen near where the tumor had been removed. And when they did scans, I don't know whether they did a different kind of scan. They found that she now has a 3-centimeter tumor near her bladder, the tumor in her abdomen, and multiple small tumors in the abdomen. So she's supposed to start immunotherapy this week.
Andrew, you're on mute.
Hey, Lois. Go ahead and introduce yourself, Tom.
Right. Hi. The way I'm related to RMC is that my 15-year-old daughter was diagnosed last year with metastatic RMC. She started chemo, although it took people here in Greece about 2 months to end up with the right diagnosis. We went to hospital because she experienced extreme coughing and pain in her left femur. She was an athlete, so they didn't realize that something else was going wrong. It was pretty obvious that all this pain was due to her spore. But anyway, we ended up in hospital in a bigger city here in Greece, and after thorough examinations, she was diagnosed with metastatic cancer, but and it was actually poorly differentiated, as they called it, but they couldn't see where it, they couldn't realize where it started from. The specimen, it was from the armpit, node in her armpit, where they took, but they didn't, they couldn't understand where it started. It was almost everywhere. There were signs in her bones, liver, lungs, uh, right kidney, of course, but we didn't know back then that it was the cause of the whole thing. And some lymph nodes were affected. And then she started chemo. There was liquid in her both lungs. That's how the situation started with us, because this coughing was topping up day after day, and then fluid started building up. So we started with her being in the intensive care unit for 2 days on machine support, and they put there they had the Hickman, the catheter fixed to her, and 2 billows. Do you know this? It's a kind of device where the fluid from the lung can be drained. She got out of the intensive unit last March after 2 or 3 days being there. Started chemo. They started chemo, of course, and the situation got better ever since. That was the worst period of her journey. 2 months later, tumors started decreasing, although we still didn't know where it started from. And then a doctor suspected that it might be the kidney that caused the whole thing. So they sent the specimen to Athens, to a bigger hospital, and they analyzed it there, and the analyst there found that it's RMC. Nobody knew what to do after the 2 months of the chemo treatment, the first line chemo treatment that she had. Nobody knew in Greece what to do after that. And then it's when I found the RMC group, and Professor Tanir and Mzawel, and the doctors communicated with them, and that happened in May. So since then, there is communication with the doctors in MD Anderson. She changed some regimens ever since. Last February, there was an nephrectomy of the right kidney. Now, what the situation is like, she's in a really, really good condition. There are some signs of cancer in the lung area, only the right lung, no sign of fluid ever since. But the thing is that now it's expanded in both breasts, but the whole situation seems to be really good now. We'll have some exams at the end of the month to see how the tumors, or what size the tumors are now. Forgot to tell you that all the other signs of the rest of the body have disappeared. I mean, no signs in the bones, liver, lymph nodes, nothing. Just the lung and now the 2 breasts, something that it wasn't in the beginning. She didn't have any tumors in the breasts. And there, it's something strange. It's not like a solid tumor in the breast area. It's what RMC does. It's like spreading in the tissues. You see what I mean? Because RMC does not only create tumors, but it affects the tissues of the areas. Anyway, that's more or less. Now we are on a different regimen because she got really tired with heavy chemo. Basically, and specifically emotionally tiredness, because her blood counts dropped, and she had to be uh, to have blood transfusion and platelets transfusion. And although we didn't have to be in the hospital for treatment, we had to go for all these for this fixing of her blood status. And after the last the last examinations about a month ago, or more than a month ago, Professor Mzaul suggested another regimen. That is the daily pill, erlotinib. I don't know if you've heard of that. And every other week, she just goes to the hospital for some hours for having another drug, Avastin, for a few hours, and then we come back home, and that's it. It seems to be, I mean, the
Lola,
tumor,
I got a quick question.
pardon? Yeah,
Um, what's her current status as of right now?
yeah, she feels really well, strong. She can go out and have fun. I mean, she's really good, her bodily condition. As for the tumors, there's presence of cancer according to the scans last month, in the lung area, right lung area, bottom part of the lung area, and in her breasts. So that's what we are fighting at the moment. When we had the scans, her left breast was really swollen. Okay, and we had the mammogram as well, and they assured that the situation is pretty much like cancer, because we didn't have another biopsy in the rest breast, because they know that it's this it's the last, let's say, metastasis there. But now her breast is not swollen at all. It seems that this new regimen works really well, but we have to see it. At the end of the month, we'll have a CT scan for the lungs and abdomen MRI to see. And
Hey,
I don't know if we
Lois,
do.
Lois, I'm
Pardon?
sorry, but we still have a
Yeah,
couple more people that we need to introduce, and then we have a new
yeah,
person
okay. Yeah,
online. Is that okay? And then we can
yeah, yeah,
come back
definitely.
around to you. Yeah, we
If you
just
need
need
to
to
ask,
get, yeah,
yeah,
we
if
just
you
need to
need to
get
ask
Anna.
anything, yeah,
Yeah, we just need to get Anna introduced and everything,
yeah, sure,
and she could tell her story, because I see Milton has just come on the call as well. Is that okay? And we'll come
yeah.
back around to you.
Oh, definitely, no problem. Yeah, no.
Okay, thank you.
Okay,
Okay.
Richie, you want to go ahead and give a introduction?
Oh, okay. My name is Richie Johnson. I am the president and founder of the Chris C.J. Johnson Foundation. And just real briefly, Chris, my son, who passed away at 39 years of age with RMC, just 15 months after diagnosis. Just to let you know, back in 2012, there were not any treatment modalities. available specifically for patients with RMC, but now we do. So there's been some progress. And it's because of Chris's inspiration that we now have this foundation so that we can help others. And then I could talk a little more about a little bit later, just so we can get everybody introduced and talk to Anna.
Okay.
Welcome.
Do we have Milton on?
Yes, can you hear me?
Yeah, we can hear you. You want to give a quick
Ye-
introduction for Anna?
Um, well, my name is Milton, and my son, Micah, he has RMC, and we are currently in treatment, and there's been a little change because his oncologist is leaving the hospital. So it's a little bit of, it's not even a little, it's very disturbing right now for my son and myself. So we're just processing it right now.
Okay. All right. Well, my name is Andre Sneed. I was diagnosed with RMC back in April 2019. I went through several different regimens of chemotherapy, immunotherapy, in conjunction with radiation, all at MD Anderson up under Dr. Masal. Um, I did that for about a year and a half, and my scans came back clear in October 2020, and then I had uh, 3 scans so far. 3 scans so far, all of them been clear. So now I went from getting my scans every 3 months to every 4 months. So I'm very excited about that. Um, and I just want to say that, Anna, this RMC support group, we're here to support each other, to share our experiences with RMC, whether we have, caregivers or people that, actually, been through this disease. So we're here to uplift each other and to share our experiences through video or through the chat window. So if you can go ahead and introduce yourself to the group, that would be great.
Sure. So my name is Anna Miranda Maldonado. I am 42. I started having symptoms at the beginning of, actually the end of April. I started having blood in my urine, and I was noted to have a mass in my kidney, and my left kidney. At the time, and there was concern that it could be a malignancy. So I had a subsequent MRI, a CT PET scan that showed that, fortunately, the RMC was not spread. There's a lymph node close to the kidney that looked a little bit enlarged, but other than that, it seemed like I had just a 6 centimeter mass in my left kidney. I got that biopsied towards the end of May. And like I said, about a week and a half ago, actually, it'll be 2 weeks today, on May 25th, I got the final diagnosis that it was RMC. I was really worried that it was RMC because I knew that I carried sickle cell trait. And a very good friend of mine reached out to Dr. Masul because we saw that he authored a lot of papers on this malignancy. And I was scheduled to have a nephrectomy last week. And Dr. Masul recommended I have chemotherapy first. And so I started chemo yesterday. Fortunately, it was fine. I had a small hypersensitivity reaction, but I did okay. I feel okay today. I have 2 young boys. I have a 6-year-old and an 11-year-old. They're my main inspiration to fight this disease. I also happen to be a doctor. I'm an internist, a general internist. And so this is a very unusual experience for me to be a patient because I had no medical problems before all of this. And it's hard for me because I had to stop seeing patients 2 weeks ago. And it's hard that I've dedicated 20 years of my life to become a doctor, and I can't practice medicine right now. That's a big adjustment for me. I'm encouraged to hear, Andre, to hear your story, that you are doing well. Because, when I read through all of the literature on this cancer, it's hard. It's not very hopeful. But I'm very grateful for you, Richie, for putting together this organization to give people hope and to help support Dr. Marceau's group and the research that they do, so that lots of us can benefit from the science that they are working on to help battle this cancer. And thank you for having me.
That's great. We're excited to have you join our group. If you have any questions or concerns about, treatments or what to look forward to moving forward, I'll be happy to ask, or anybody on the panel will be happy to ask as well.
Thank you.
And Anna, how long have you known that you had sickle cell trait?
So I found out when I was pregnant with my youngest son. I was 35 when I was pregnant with him, and they do, in California, we do universal prenatal screening for women over 35, and I was told that I had sickle cell trait when I was pregnant with him, and he carries sickle cell trait, and so do two of my two older brothers and some of my nieces and nephews.
Mm. Oh, okay. It's a great story, but just don't lose faith. It seems that they caught it early, and just don't give in and remain positive as you walk through this. And you have all of us here for you. I'm available 24 hours a day by
Thank you.
telephone, so don't feel bad if you wake me up. It's okay.
Thank
Okay.
you. I appreciate it.
And we'll
I
share
live
our contact info with you.
As I
Okay,
say, I live in San Juan Capistrano, so not super nearby, but not that far away in comparison with a lot of other people on the call.
Well, that's
thank you.
good, Lori. Who is caller 00?
That might be me.
It might be me. Is my name popping up? This is Joanna and Caleb's mom.
We see you, Jelana.
Oh, okay. Hi, everybody.
Hi.
Hey, Jelana, we have a new person on here today. Would you like to introduce yourself and your son Caleb to Anna?
Yes, hi. My name is Joanna Wheeler. My son Caleb, he's 11 years old. He was diagnosed with RMC in 2018.
Where's
Um,
your picture, Jelana? Excuse me for interrupting. We want to see your beautiful face.
okay, hold on 1 second. Try to cut my camera. Hi. Did it? Hi. Can you see me?
We can see you.
Yes, we see you. Why did you want to hide your face? You're beautiful.
Oh no, I was kind of cleaning up the kitchen, and thank you, but I was kind of cleaning up the kitchen, and we just got out of the hospital today, so
Oh,
I was kind of cleaning up. um, where did I stop it? Oh well, my son Caleb, he was diagnosed in December of 2018 with RMC. He did well, and we recently found out April 15th that he relapsed, and we're still battling RMC.
We're with you, and we want you to reach out to us, Joanna. We know how difficult this is for you, but we're here for you. Okay.
Back on the
You got that.
chemo, is he back on the chemo regimen, Jelana?
Well, actually, today we just found out that we're gonna stop with the carboplatinum, the gemcitabine, and the Paxlovid. So we're gonna move on to another treatment. I can't quite pronounce it. It's I don't want to chop it up. It's Erlotin, and starts with a B. I wonder if I could type it somewhere.
It's
Type of-
erlotinib. It's a treatment that's usually used for lung cancer. It's based on an EFGR positive finding in the cancer, and I think Lois's daughter is on it.
Yes.
You can type it in the chat.
I shared it on my Facebook page. It's I think Dr. Masal talked about it. And I shared it on my Facebook page. I'll type it. I'll try to find it somewhere, and I'll type it in.
Is it a pill?
Yes, it's going to be an oral chemo, and I think
It's erlotinib, yes.
yes, it's a Latin, and it starts with the B. I can't pronounce it. It's a very long name, and he'll be doing those 2 chemos. We're gonna start next week, so we're gonna stop the carboplatinum, gemcitabine, and the Paxlovid. So I kind of figured, it wasn't quite working as well as it had been in the past because I was still drawing fluid from his lungs. So, but they told me today nothing has changed. We're at a standstill right now. It's not getting worse. It's not getting better. It's just we're just at a standstill. It's just pretty much the same.
Definitely praying for Caleb,
Thank you.
Okay, we're just gonna go around and see if
You didn't introduce Alexa. I'm sorry.
okay, she's back. Is she back on?
Yeah, she's back on.
I'm back.
Oh, okay. All right. Alexa, go ahead and introduce yourselves to Anna.
Sure. Hi, Anna. We're so happy to have you here. And you are the exact reason why we have support groups. We don't ever want anybody to face anything alone. So I'm so thrilled that you're here. I'm Alexa Jett. I'm an actual cancer survivor myself. My connection to RMC is through Chris's husband, Carlos, who has been with the Lord now for over a year. And I love Richie, I love Andre and Carissa and everybody and Caleb and Joanna and Lois. And so we're just all happy you're here tonight and whatever we can do to help.
Thanks, Alexa. So we're going to go around and see if anybody have anything to add to the group tonight or anything you want to share. Carissa, you have anything you want to add or share with the group tonight?
Not right now. Maybe something will come up though.
Okay, all right. Milton, you have anything to share with the group tonight? All right. Or any questions or concerns? You're on mute, Milton. Milton, you're on mute. We can't hear you.
And if someone has a TV, if we can ask everyone to mute if you're not talking so that we won't have the background noise, please. Thank you.
Milton, I'm going to send you a request to unmute yourself and that might make it easier.
Go ahead, Milton. No,
No,
I was I was just going to say something. I was going to say something that I think might be important for Anna. Only now in the last month has someone suggested that we get what is known as a health advocate or a patient advocate. Anna may be more familiar with those people than I was, but there's organizations. One I think is called Patient Advocate. Another one is called Health Advocate, and they will help. It doesn't sound like if your practice is with Kaiser, you're going to have a lot of trouble with Kaiser treatment plans, but they also would help with long-term disability and other types of organizational stuff that becomes harder to do downstream. And I wish we had known about this earlier. I'm not saying that specifically about the support group. I just wish we had known and been able to plug Kwanzaa into those people. They will, with your permission, be able to interact with disability insurance and health insurance and other types of institutional things that move slowly when you need them to move quickly.
Thank you.
Milton, did you have anything to add?
Oh, what I mentioned earlier, to me, it has to do with patient care and the interaction with the doctor that's treating the patient. As I said earlier, I guess at the beginning when Micah started treatment, we actually came about with a series of events where he started in. I'm echoing. Let me try to see if I could use my phone. I'm gonna mute my mic and use my phone, see if that works. All right. Oh, that still is me. So, anyhow, it was a pediatric oncologist who first discovered that Micah had RMC, and that was from when he was in emergency room and actually the ICU, and they did a biopsy, and they pull samples actually not from his kidney but from his lungs because another physician has said it's going to be the same tumor, or so there would be no need for them to do any type of incision into his side and just pull the biopsy from his lungs, which they did. And then the oncologist said that the best he was not capable of handling the treatment of RMC and referred us to a colleague on the adult side. So now we're dealing with Micah was 19 at the time, and I think he's still qualified to be actually in the pediatric wing, but this hospital did not, now I know, did not have the facility. I think for me overall, what I've been experiencing is an education through looking up resources, information, and through the CJ Foundation and anything similar to it, learning more about RMC and what should be followed as far as protocols. And I guess in retrospect, if I had known more, my approach would have been different as far as selecting who would take care of Micah. I've become more concerned, or I had some misgivings during the process because one thing is noted. When I had sent some information, screenshots from my chart and other things to Richie, she pointed out that they were listing him as having RCC, and now I'm feeling that their approach to treating him was not as aggressive as it should be, because I don't know if they really were able to differentiate or or say that this is RMC that he has and it's an aggressive type of cancer as opposed to RCC. And I think my first education as to the difference was when Richie pointed out months ago that there is a difference. And I follow up on it. So I've been watching what was being done and the care they was getting. And for example, he had a lot. He's been through a lot as far as he had peritoneal cancer growth after his kidney was removed that was not addressed, but I saw it on his chart from his scans. And then subsequently he developed I guess it's a peritoneal growth or cancer, but he ended up having ascites and had to be hospitalized. And during that time, I got pretty upset because the palliative department came by and they were acting as if he wasn't going to make it out of the hospital. And I slept in his room the entire time for 9 days. And he made it out, and they subsequently did he had radiology, and that actually helped him. And then again, he had another draining of the fluid in his abdomen, and eventually, once the radiation had shrunk the cancer, that stopped. So he had another scan, and they said, okay, well, the cancer, the tumors in his lung had doubled in size, and it was kind of like pushed aside as if, it will eventually shrink based on the chemo. And what has happened since then is in my gut feeling is that because it wasn't addressed, he now has the issue where there's fluid in his lungs, same as as Caleb is experienced, identical. As a matter of fact, when I saw a picture of him being drained or the fluid, a week later, Micah was doing the same thing. And what I meant by care, I believe that there should be, at least my experience, as there should have been more, I guess it's bedside manners for this physician or care, because yesterday, this oncologist just told us that he's transferring to another hospital, and we have till July when he's going to treat us, and then he's off, and then we're on our own. So Micah and I are still processing it in a way. I feel moving forward that with the knowledge that I have now, I can move forward, and I'm looking at 2 hospitals that one Sharissa had mentioned, but the thing that I'm dealing with is I'm dealing with my son. Has a bit of, he's upset, but then yesterday during dinner, he kind of lashed out a little bit because I had mentioned that we were changing doctors, and he wanted to follow this physician to his new hospital, and I said it wasn't going to work for me. Just what we've been through in the closest, I wanted to be within the city limits, if anything, that I could get around. And this is now in White Plains, New York, and it's not a good fit. So he's still processing that. So I gave him a list of 2 hospitals. One is Sloan Memorial Keating, which happened to, on their site, they actually have it differentiated between RCC and RMC. So I text that to Micah because just our interaction, I didn't want to get him upset. I wanted to make it seem like it's his idea or, hey, I want to look at that. And I was out in the rain, and he actually called me and asked me a question. He said, Dad, they deal with pediatrics. And I said, well, you're 20, but you still qualify. And then I said, the reason why at NYU you were in the adult side, because when he's being treated, everyone there is at least 3.5 times his age. And he's by far the youngest I'm 62 and I seem young to pick compared to the other patients that are being treated, and they're not being treated for RMC. It's different types of cancer, and I think mainly might be lung cancer, or some derivative of some type of cancer. But he's the only RMC patient in that clinic that I know of. And I think part of looking back, that this physician, this is his, I can't call it for sure, but just by the way they've moved, that they've never had any experience dealing with RMC. And no matter how much experience you have doing other things, I think his professional ego has gotten in his way, because I had suggested that he get in contact with MD Anderson, and his nurse practitioner kind of got defensive about it. And my philosophy is, wait a minute, this is my child. I really am not concerned about your professional ego. And now that he is moving on, looking back, I feel a sense of frustration, as if my parental intuition, as if he didn't seem as engaged, was warranted. I could be wrong, but it's just my gut feeling. And that's one of the things I'm processing right now. And so it's kind of really painful, because I feel I'm wondering, did I do my son an injustice by not doing anything earlier and making a move and find out information, because I had trust and at the same time you push that aside and move forward. And Micah really believed that, okay, this is the best oncologist in one of the things quoted, well, this is the best one in New York State. And I didn't want to tell him, well, hold on a second. That's not necessarily true, but it's his belief, and he has to have something to hang on to. And the frustrating part for me is that he's very resilient, and he's a tough kid, and in some way you've crushed him a little bit. And even some of what he's going through, I told Richie that I've seen less of a spark in him, not just now, but since he's had the procedure on his lungs. And it's extremely frustrating. And as I said, I'm dealing with it as best I can. But we're moving on, and now I'm going to be able to make proper decisions, and even try to make sure whether we select that they're communicate with MD Anderson, Dr. Tanier, Masul, whatever, the whole party, and make sure that we do the best for him. And at least now I know I'm going to stand up and say, if you're not doing this, then you're not doing right. I don't care what your ego is. It has to be a team effort. And early on, even at the beginning, before he had surgery and had the nephrectomy, I had to send him a email and say that the surgeon who removed it and the oncologist, they weren't communicating. I was new to my chart, and I was having appointments left and right. And I just said that that the whole group is acting very dysfunctional, and I'm coach sports, and has to be some organization. And they apologized and blamed it on COVID for them not meeting in person. But that was kind of a cop out. And since then, that feeling never left me, and now it has kind of come back in the whole process. It's extremely frustrating.
And I think what you're feeling, Milton, is normal. But don't beat yourself up so much. I mean, you are doing the best that you can do. This journey is rough, and you learn as you go. And as a parent, you feel like your hands are tired, you feel tied at least, and you feel helpless. But I don't want you to feel that you're not doing the best you can do. And given the age of Micah,
Yeah.
he want that independence, but yet I know you want more because you see more, but give him a little space. And yes, it's extremely important that we move pretty quickly because this cancer is aggressive. We don't have time to play. But I
Yeah.
think let him process it a little bit first, because I think things are happening too fast. And anybody else, you could just feel free to jump in. Just from experience, with Chris, I know how difficult it is. But just try to stay strong. And as I said earlier this morning, if you need to cry, get you a quiet spot.
Yeah.
You let it out, and then you pick up those pieces like a big boy and keep going. But
Yeah.
there's some times that you just cry your eyes out. What can I do?
It's like I've read the copy of pieces at a time because sometimes the Chris story, the book that you give me, and I'm like, wait a minute, this is what Mike is dealing with right now. It's kind of scary in a sense because it's um it's like I can really identify so much what you have experienced, and I'm like, okay, this next chapter is what's going to be next, and I'm encountering some of it, and it's I have hope, and yeah, that's all I could say really. Just it is tough for me.
And it's always fear of the unknown. It is always fear, but just don't lose your faith. Keep hope alive. I mean, there are just so many different treatment modalities now as compared to 8 or 9 years ago. So we just got to get it on the right track, get the right physicians in there so that he can receive the treatment that he deserves. And that's the main
Yeah.
thing.
I also just want to add that I think it is important that you continue to advocate for him and ask your treating doctors to be willing to work with the specialist at MD Anderson, because as we all know, experience really matters, and a lot of physicians do not have experience with this cancer. I
Yeah.
myself had never heard of RMC. My urologist who was going to operate on me, did not have a lot of familiarity with this malignancy. And fortunately, my oncologist did, and he was willing to work with Dr. Masoul. So I think it's not inappropriate. You should not feel bad that you have to sometimes push us in medicine to understand the difference between this malignancy, because it is not like other kidney cancers at all.
Yeah, and I tend I mean, I do agree with what you're saying, and I tend to believe that the physicians that Micah had previously were not communicating with Dr. Masal.
No, we kind of like a new treatment was Lymphosis. Uh, it's like every time Micah has, all of a sudden he jumps and there's a new change. So when he had an issue with his diet, uh, we started, but he didn't start right away. So even today, based on what happened on Monday, he said, well, Micah stopped taking it, and at the same time, he started stomach issues again. Micah is
You're breaking up a
It
little bit,
always
Milton.
happens. Hmm?
You're breaking up a little bit.
Okay. All right. Okay.
That's better.
So, whenever Micah says something about how he feels, every single time a subsequent test proved him to be correct. He understands his body, and he also, does research, because even he was being asked questions and he was speaking, using the same medical terminology that the ER physician was asking him, and he said, "Does he have, is he in the field?" And he said, "No, I just do research." So he's aware of things. But now with this Lymphosis, all of a sudden we stopped taking it, and I have I actually called the company that distributed it, because I have 3 unused bottles still in the packages, and they told me that they'll take it back, so I'm going to have that shit back. But it's just the fact that that's something, and that the reason why I mentioned that was that the talk was, this is something that was from a trial study at MD Anderson. So he kind of said that to make me feel at ease, but now he just tried it for a month and you stopped it, you just abandoned it. And so that's very confusing, and that's why it gets me a little bit more frustrated and angry. It's like, what are you really doing?
And you don't want to discount that you've been doing all of this during COVID. I mean, I think that that's something you want to give yourself credit for, as well as give you the extra energy to say, yeah, you do have to push people because they aren't communicating. Just to give you an idea, when we went to the City of Hope the first time, and they got Kwanzaa scheduled for something really quickly, I was like, we'll buy them a box of chocolates and we'll take the chocolates. And when Kwanzaa goes to the hospital, she'll give this box of chocolates to all these people that have helped us. And none of them were there. None of them were at the hospital because of COVID. So you're fighting not just what you're, trying to do with the, perhaps not a great oncologist, but you're fighting systems that are just really constipated right now. So keep at it.
Yeah, no, I will.
Okay, thank you for sharing, Milton. Alexa, you have anything to share? Any questions or concerns?
Wi-Fi isn't set up. For help, go to your...
I love when that happens. One time in a meeting, 3 of them all went at the same time in different rooms. It was great. So I just have 2 little things. I want to remind everybody that CancerCon is this weekend. It is for patients 15 to 39 patients, caregivers, and anyone who helps AYA. So Richie, you are included. It is a great free resource. And there's lots of fun and activity for young adult cancer patients to meet other young adults. I will put it in the chat. And my second note, if this support group has helped you, then would you please write us a testimonial on Great Nonprofits, and I will put the link for that in the chat. And that's all I have.
Okay, thank you for sharing, Alexa. Appreciate it. I see we have Diana and Daniel on the call. Diana and Daniel.
Hello.
Hey, do you have anything to share or add with the group this evening?
Excuse me, but I didn't understand you. Could you repeat us?
Hey, good evening. I was seeing if you had anything to share with the group or any questions or
Okay. We continue with Nicolas. Nicolas he has made COVID, and later all the family was with COVID. And now we are fine, fortunately. He has many controls at the hospital, and now we continue with the 5 cycle for the treatment. He has the platelets very down, but today was the first day for the school of Nicolas after more than one year. We are really happy that he has 1 week to normalize his life.
That's great. Thanks for sharing.
Thank you. And all the scanners that he has in April for tomography and all the magnetic resonance all work clear. We are really happy that the treatment was very good. Anyway, he must to continue almost 1 year more with the chemo.
That's great news. Thanks for sharing that positive information. You know, it's always good to get, a positive testimony. Um, Richie, do you have anything to share this evening?
I would just like to share that we did start a GoFundMe page for Micah, and it's on the Facebook website. The website's Facebook. It's been crazy for me, but and then also I am being interviewed by GMA3 on Friday. It will air Friday at 12 o'clock. So it will be channel 13, but ABC, wherever you are. So, oh, there is Micah. Hey,
Micah, how's it going?
I like your head, Micah. You look handsome.
No, you can use my phone. Oh, I don't know if you got here. Here. Howdy.
Howdy. You look great.
Well, I do it. I'm gonna use it. Whatever.
It take a youngster to help us old people out.
Okay, all right. Yeah. Let's play with him. Just go ahead and talk. I don't know. How's it going?
It's going well. How are you?
It's going. It's going as good as I guess getting so far. So
Well,
um,
we would like for you to meet the group here. We were just so happy to see your smiling face.
yeah.
Any questions?
Definitely good to see you.
Yeah. Good to see y'all too. Oh, y'all knew. Yeah. Wait, have you been talking to him? Yes, I spoke to him. See you. Oh, okay. I thought this was a different group. No, the same. I'm sorry. I haven't gone through it. Okay, I think you done. Yeah, I'm going. Let's go finish eating dinner.
Good seeing you, Micah.
Yeah, I told him I had made dinner. That's why I wasn't at the beginning, and then I said let me call him so that he could at least you could see his face.
Milton, could you put your email in the chat so I could send you some resources for young adults with cancer?
Yeah.
I have it too.
Do you want me to tell you or
okay?
Just or all right. It's md.wade@yahoo.com.
Yeah.
Okay, great.
I have a question, Milton. How much fluid are you draining from Micah, and how often do you drain?
500 milligrams, I think. That's that's what it was.
Milliliter?
Milliliters. Or I can't. I'm not good with the sizes, but it's 500. That's all I know that market. So the reason why we did that is it said that if it was more, eventually it would hurt his lungs, and they want to keep some fluid in so that there is some space. So at the hospital, uh, the most they've drained was they've always, and when he was in the ER, they kept it at 500. Say no, 700, and that was before they did the procedure. So they said they didn't take him out because they wanted to, when they put the tube in, they wanted to make sure that the lungs didn't collapse on him. So since we came out, I restricted and said we're going to keep it at 500, no more, and he gets drained he drains himself like so every 2 days. The first and now the challenge that he had tries to be independent, putting back on the tape and the tube. We tried doing that, and it was a disaster the first time out. He went through 3 different kits, and the reason why it was 3 was that he refused to let me help him. And the challenge was him trying to, now the tube is on his right side, and he's using his left hand to try to put tape on to reach around to his back. And I had watched twice soaked them in rubbing out alcohol, and yet he figured they were still contaminated. So that's something I'm dealing with. Someone who wants to be independent and so on. So that's been the challenge with him. So the last time, so he's done it twice. The second time, he allowed me to hold the gauze. So that's progress.
Baby
Yeah.
steps.
So how many times are you draining your son?
Can I ask something?
Yes.
Just a question to Milton and Jalana. Do the doctors there allow you to drain the fluid yourselves? Because here in Greece, I don't know, they're so afraid of infections, and that is the reason why we were in hospital for about 2 months last year, when we had the same situation with building up fluid in the lungs. And I remember Fenina staying in bed uh, the first few days, but then okay, she started walking, but she had these devices fixed on her all the time. And I didn't know that there is this, let's say, freedom to take this on and off. Am I right? Did I get it right? So you
Yeah.
drain it, you drain it every now and then, right?
I know for
Three,
Caleb.
yeah.
Oh, I'm sorry. I know for Caleb, I drain every 2 to 3 days, depending on how much fluid I get off of one day. Every 2 days. If I'm draining a lot of fluid, they want me to drain more often. Let's just say if he's filling up the whole bottle, they want me to drain maybe the next day or so on. Since I'm not getting that much fluid off Caleb, I get maybe, I think I'm saying this right, maybe 150 to 250 cc's off him when I drain. It's not much, but it's still a lot from in the
But
beginning.
but the device is all the time fixed on the body, or no?
No,
No.
it's just
Okay.
it's a bottle, and
Mm,
he has these drains put in, and I connect the bottle to his the
right.
drain that's placed
Yeah.
in, and I drain the fluid off.
Yeah. Probably they don't have this freedom here, and they had the tubes all the time fixed. and the tubes were heading into, let's say, bottles, okay, on the right and the left side of the bed, and it was draining throughout the day, and
Oh,
that lasted for about 1.5 months. The left lung finished earlier because didn't have any problem, any tumors. The right lung lasted more for Ferina. Totally 1.5 to 2 months. But then they removed the devices. And a month later, last June, when there was some more fluid building up in her right lung, they did a kind of injection from her back, and they drained the fluid, and that was it. We didn't have to do anything after that because the fluid stopped. Okay, and they didn't have to continue draining, but that we were very dependent on the hospital those days, and the reason was that they didn't have this freedom that you are mentioning, which is nice. You can be at home, I guess, right, and do that.
Yes.
yes,
But
I was told. Yes, I was told that kids do better at home, and
yeah,
so to prevent infection, they really don't want, us there a lot. So
yeah,
if he's doing well, if his counts are right, then we usually go home. If he's not really sick, go
yeah.
home.
Okay, right.
Yeah, I know for Carlos, he had that, and like they did twice, like where they did at the hospital and just did the back thing and drained it out. Uh,
Yeah,
but it kept building up, so they did the pleurodesis, and they had him
Yeah.
in a couple days in the hospital with that drainage tube where it would suck automatically, and then after that they inserted the tubes that would connect to the like the special bottles for drainage. So like the tubes were there for a while, and I
right.
think had to drain for a month, and then they end up taking the tubes out for him. But yeah,
So Carlos continued at home as well with that.
yes,
Yeah, okay. But I think it eventually stops. Fluid at some point will stop because the doctors here said that as the tumors shrink, okay, eventually it will stop producing fluid. So at some point it will stop. That's what they had told us back then.
I know for
That's
Caleb,
correct.
I'm sorry.
Yeah,
I know for Caleb, we restarted his carboplatinum gemcitabine and paclitaxel, and he did well the last time before he went into remission. He did really well on that, and I was hoping that it will continue to work well. Him restarting it, and for some reason, it's just he's not doing bad. No new tumors. I found out today. No new tumors.
Good.
It's not progressing, but I'm still draining fluid. It's not working quite as well. So they told me that we'll have to change chemo, and so I'm hoping with the new oral chemo, um, less, doctor visits, and I'm hoping and praying that he does well with this oral chemo. So I'm hoping that we get the drains out because the drains are very, very painful for him.
mm.
Me draining fluid off him is very, very painful. Um, is Micah experiencing pain when he gets the fluid drained off him?
Um, he, they told him to do it at his own pace. So once he's done, he'll have some discomfort breathing and so on, because that's the lungs expanding back. So he's in some discomfort. Of course, it also makes him cough, which is again the lungs expand. So him being controlled, then at his own, because with the device, he can control how quickly. And then the nurse, before we left, said quickly, so that creates a discomfort. So
You breaking up
that's
a little
probably
bit,
one reason
Milton.
why. I'm sorry.
You breaking up a little bit,
Oh.
maybe because you don't have the phone up.
Oh yeah, I'll put now. You can hear me better.
Yeah.
Yeah. So he controls that. So he monitors his own pain, and so there is some discomfort in it, but after a while there is a relief. So that's the most important thing. It's just that at the initial draining, then there would be the discomfort, but the overall result is worth the little bit of discomfort that he feels.
Mm-hmm.
Could I ask something else?
I'm sorry?
Could I ask something?
Yes.
I don't remember who. Andre, you mentioned about immune therapy, and I don't remember who else. What do you actually call immune therapy, and what does this involve? It's uh, part of chemo. It's like chemo, or some of the drugs are that they give are part of immune therapy. Is it something special? Because you mentioned that, Andre.
Well, I guess I could take that. And Mike, well, before we did anything, even before the surgery, the removal of his kidney, the oncologist had suggested immunotherapy, and the surgeon overrode him and removed his kidney, which is when I said there was some miscommunication. So after the removal of the kidney, the immunotherapy that we were on, the treatment was Opdivo and Yervo. They work together, and the whole idea is to let the body recognize the cancer cell, because the cancer cell seems to disguise itself, and the body does not. It does something and makes the body unable to recognize that it's dangerous. So the Yervo and Opdivo, the chemotherapy, is to awaken the I guess it's the white blood cells. I'm not sure, but whichever one fights it and says, "Hey, this is a foreign substance," and to attack it. And the goal is that moving forward, once the body adapts to recognizing the cancer cell, then the theory is that whenever it comes back, it will be destroyed.
Right.
So that's what was going on, but I believe that they felt that Micah's cancer was too aggressive for it. So when he was hospitalized and came out from the peritoneal, the issue with the ascites, that's when they decided to abandon it, which was a little bit frustrating. But as it turns out, they abandoned it, and then now the chemo that they were using, it was just cisplatin and gemcitabine. That now they're saying that wasn't helpful. So they Monday they tried the 3 new drugs, and he had a violent reaction to one of them. And I think someone has mentioned the Plaxetil. I think, I'm not sure if I said it correctly. That's the one that
Paclitaxel.
that they
Paclitaxel.
really, yeah,
Yeah.
he's one of the ones that he cannot take that. So
Mm.
it was an emergency situation. The nursing staff, they all had to run over, call the doctor down, and everyone attended to him. And so tomorrow we're going in to try a different, safer one for him
What did
to continue.
the drug cause? The paclitaxel. What
Um,
did?
he just started shaking and hyperventilating,
Uh,
and so they had to try to flush him and give him a shot of steroids
mm-hmm.
and
Yeah.
something else, and that calmed him down. They gave him oxygen right away,
Yeah.
and they monitored him till they were sure that he was safe to leave. And then they said,
Yeah.
it's one of those chances where he has an allergic reaction, and lo and behold, that was the one he cannot take.
Yeah. Okay.
So
It was
so we're moving on
too.
from there.
Yeah. It was too toxic for him.
Yes,
Yeah.
but my goal is to eventually go back to the immunotherapy. I believe given time it will work, but who am I? I know. We'll see.
Yeah.
Just something. I want to add something. So I did several different combinations of chemo and immunotherapy. So different combinations work for certain periods of times, and I would get a scan, and then it would show that the cancer is starting to increase. So Dr. Messiah would abandon that treatment and go to something else. So we would go to chemo, we would try immunotherapy. Immunotherapy worked for a little while. After it stopped working or the cancer became resistant to it, we went on to something else. So he kind of stayed on top of it. So I guess abandoning a treatment plan ain't all that bad if it's not working anymore, because cancer
Yeah.
does become resistant to those type of treatments. So, and this cancer is very aggressive, so you got to kind of stay ahead of it or whatever. So if a plan is not working, it's okay to go to the next combination of treatment. I think I started on like gemcitabine and doxorubicin, and that worked for a little while. It stopped. I went to immunotherapy. I went to the Opdivo, and I forgot the other name of it. That worked for like a couple cycles, and then the cancer became resistant. And then I went to cisplatin, then carboplatin, and paclitaxel in conjunction with radiation, and that finally kind of killed the rest of the cancer cells. So just be mindful of that.
Okay.
So
But
I think that because Fenina was taking in the previous regimen, one of the drugs was called bortezomib. I think this is part of immune therapy, like the one that she gets now, erlotinib, because I read that it belongs to immune therapy drugs. I don't know if I'm right. So as you said, Andre, it's a combination of chemotherapy and immune therapy. So some of the
No,
drugs, no,
erlotinib is a chemo treatment in a pill. My mother had it for 5 years.
yeah,
It's
the
not
pill,
it's not an immunotherapy.
right? Bortezomib,
Opdivo is the immunotherapy.
Abivo. Ah, okay, no,
It's the one I took.
yeah. Was erlotinib helpful, Lori?
Yes, and so I'm interested in everyone using erlotinib. So my mother did not have RMC. My mother had non-small cell lung cancer. And at the time, the first line of treatment, it wasn't considered experimental, but the first line of treatment was chemo. So my mother did 12 weeks of chemo, and then they put her on erlotinib. And they checked her cancer first to make sure that it was, at the time, susceptible to erlotinib. It seems like they've expanded the use of erlotinib past what they used to do, because this is about 8 years ago. And she was very successful. It shrunk tumors, and she lived 4 years very successfully on it and continued to take it in the last year as well. So did it with non-small cell lung cancer, did it cure her entirely? No, her center tumor was next to her aorta. So they couldn't operate and they couldn't do radiation. But she had tolerated it very well, and and it worked. So I'm
Did it cause any rash? Something on the skin?
Yes, it does. It has a skin reaction, and it made her nose run.
On the nose?
On the face also, and they gave her a cream that helped control it. But yes, it does cause a rash.
Fenina too on the nose and the cheeks here. But does that go away? Or it's all the time that you take this pill?
You take the pill every day until either it works and it completely gets rid of everything, or until it stops working and then you try something different.
I mean the skin rash.
Yeah. No, you have to get this. I don't know what it is for the skin, but it's a topical cream for the skin. So there's something that you need to get.
Yeah, and does this go away? Oh,
it does. It subsides a lot. It goes down a lot.
Yeah. We use some creams for that, right? Yeah. Okay.
Well, you guys, we've been in this about an hour and a half. How are you guys feeling?
Yeah.
We don't want to tire you out, and it's good discussion, great discussion. So, any final questions? But maybe we can just take some notes and hold it for next month. Or if you have any questions, some need answers, just email me and we'll get the answers. We know the resources. Okay, this has been a great group discussion.
Thank you for everything. Thank you.
Yes, thank you, everyone.
Yeah.
It's
Bye.
wonderful.
Bye. Nice to see you all.
It's good to see you.
You.
You and Diana.
Thank you very much.
Bye.
Nice to see you all.
Yeah.
This conference will now be recorded.